So, results, what did we actually find after all that? The core themes were around impact of changes to mental health care, that people lost their usual support and felt that some people could engage well with online support, some people couldn't. It was harder work, especially to agree to get into, and the feeling that professionals were firefighting rather than providing planned care or missing out on care. I'd say for myself as well, it's actually been really interesting getting a view from different geographical areas of the country and seeing that, you know, some areas have put in a lot of support for people, some areas have put in nothing at all. And these impacts were quite unequal in pretty much many cases, the ways you might have predicted unequal impacts before the pandemic, in terms of participants with disabilities affecting their computer use, with limited finances, limited access to technology, people living in overcrowded housing with no privacy, that sort of thing. And again, there was difficult, unequal impacts of lockdown around stigma and judgment, because people often were talking about feeling quite stuck with their mental health problems around being around their families and communities, and without usual support from services. In some cases, this was particularly difficult for people from BMA communities, because they felt more at risk for COVID, and in some cases, specific religious or cultural needs were difficult. For example, one participant reported needing to get up at particular times to take her medication, while the rest of the family was marking Ramadan, and that being quite tricky. Psychological impact varied a lot, no hugely clear pattern on that. And another thing was relationships, connections and disconnections. And some people felt that, you know, being forced into lockdown, being forced into very close proximity to people, found that increased connection very difficult, whereas others were, of course, missing the connections that they had every day, even quite small things, just going out and being able to see other people. And there was a lot about losing informal peer support from friendships formed within services. This was particularly an issue that even when you got to your services via Zoom or in a COVID-safe manner, then people still weren't meeting each other for smoking breaks or in the waiting room or anything like that.